Hi guys, welcome to my channel. What should I do? Today I have Dr. Asgar with me, okay, who has completed his MBBS and he has completed his MD. Now he has written exam for
NEET SS
NEET SS, okay, and he has
yes
scored
335 rank, all India rank.
335 rank, All India 335 rank. Okay, so first of all, congratulations
Thank you,
for
sir.
that score. Okay, and now he is going to do DM. Okay, we will learn about those things also, and we will ask him about what youngsters should how youngsters should take care of his health. Okay, how at what age what should be done so that okay we are healthier and we have a healthy India. Okay, along with that, okay, we will see how people should become doctors in India, okay, and what all they have to study and why they have to study. So I'm gonna ask questions regarding this. Okay, can you please tell about yourself?
Thank you, sir, for the kind introduction. I'm Dr. Mirza Asgar. I have cleared my MBBS from JJ Medical College and I did my MD General Medicine from JSS Mysore. And currently, I have secured a rank of all India rank of 335. So I am opting for interventional cardiology to do my DM course.
Okay, awesome.
Currently, I'm working as a senior resident at Bapuji Hospital.
My first question is like, okay, can you please tell me us the full form of MBBS?
Latin origin to it,
Okay.
but actually speaking, if you want to speak in a layman term, it is Bachelor of Medicine and Bachelor of Surgery.
Yes. So,
Though it
but
is
why?
MBBS, but actually it means Bachelor of Medicine and Bachelor of Surgery. So
Okay.
majorly we'll be learning the medicine subjects and the surgical subjects.
Okay. So, as I know, like, okay, 20 years before, if you have done an MBBS, you are a doctor. Okay.
Right, sir.
Today, after completing MBBS, again, you have to do MD, and then again, there is specializations of DM. Okay. Why do you think this is there and this is so important today?
I think it is because of the advancement in the medical science.
Mhm.
Because day by day we are seeing so many trials going on, so much research is being done on different diseases, not just diseases, the treatment modalities, the diagnostic investigation part, everything is advancing, right?
Mhm.
So whatever the limited knowledge we had, it is advancing. So it is not possible for somebody to just learn from MBBS and
Mhm.
be called as a doctor in present day scenario
Mhm.
and give an expert opinion regarding any disease. So
Okay.
I feel whatever is there after MBBS, then you have your MD or MS course,
Mhm.
which is basically like broad specialty, and then you have DM or MCH, which is like super specialty. It is somewhere required
Mhm.
to give a expert opinion on any particular disease.
So, see, as a person who see a lot of reels in Instagram or YouTube, okay, and also sometimes, okay, whenever I want, I see so many people coming and giving advices. Okay, some people say uh, eating pink salt is good today. Okay, we have seen people eating white salt, and my grandmother has like from her childhood till 80 age. Now she is 85 something. Okay, she is healthy only 85 she has lived means she is healthy eating white sugar means white salt. Okay, today people are like eat pink salt. So in this actual confusion era where people are saying okay, sometimes people say papaya is good, sometimes people say papaya is overeat. Okay, so like not only these two things, okay, there are so
Yes,
many
there are
places,
there
okay,
are
where are people are confusing us what to eat what not to eat. So being a doctor, what do you suggest? Okay, what people should
Like,
actually do
definitely, I
and
agree
how?
with you. There are a
Hmm.
lot of people who decide on what is right to eat, what is not right to eat.
Hmm.
I feel whatever the diseases we are seeing today, it is majorly because of the lifestyle changes we have acquired over the period of years.
Hmm.
And if you see epidemiologically, if you can speak epidemiologically, basically, you can divide the diseases into a communicable disease or a non-communicable disease or a disease which is coming from a genetic scenario or some congenital disease, some nutritional disease, right, or occupational hazard disease, right. So whatever we are dealing in these day-to-day life, the major non-communicable disease are majorly because of the lifestyle we have acquired,
Okay.
right. Like whatever the sedentary lifestyle we have acquired, we are not active so much, we are not mobilizing ourselves so much, and we are bound to the junk food, the free food, the fast food, right. And the availability of food is also so much these days, so we try to acquire so much of energy and we are not matlab, spending it enough.
Mhm.
So somewhere there is energy consumption and supply mismatch, right. So this is what is leading to a systemic inflammation in the body, and that inflammation is causing variety of diseases, be it diabetes, be it hypertension, be it what do you call dyslipidemia, or any thyroid disorder. All this is occurring because of that, majorly.
Okay.
Right. Now, in this, what regarding the question what you asked me, like what to eat, what not to eat, it depends on what disease you are having.
Okay.
And sometimes a person might be okay, for his body morph and body type, he might be okay with eating something, and some person might not be okay with eating something. Like for example, if a person has a lactose intolerance, and if he is given some milk product, some mithai, some other thing which is made of milk, he might become sick in a day, right?
Okay.
So like this, I'm just giving an example. So what you need to understand is what your body can tolerate, and how much it can tolerate
Okay.
in a most optimal amount that you can eat. And definitely we have age old knowledge from our parents, their parents, what to eat, what not to eat, how much to eat, right?
Yeah.
And now that we have like so much of junk food, fast food, where we are consuming a lot of these stuff, which is causing like imbalance in the whatever I called the energy consumption and expenditure mismatch.
Okay.
So I think that is what you have to take care.
So as you mentioned, like see, people are consuming a lot of food is there and they are not working out. So, what solution they have in this era?
So one thing is, like whatever the diseases we talk about, we first before giving medication to any patient, we talk about lifestyle modification.
Okay.
The lifestyle modification starts with your diet.
Okay.
So there is a saying, you are what you eat,
Hmm.
right? So what you eat defines you. So you have to take care of the diet part, and you have to take care of the diet part in a way where you can eat what is right for you. Like in a diabetes patient, we tell patients not to eat any high glycemic index foods, be it any fruit as well. So many people have doubts regarding which fruit to eat. Many diabetes patients come to me and they are like confused, like which fruit can I eat, sir? This can I eat? This can you eat that? I just give them a very simple advice. Like most of the patients, like most of them are educated. Even people who are like moderately educated, I tell them which fruits they can eat, which fruits they can't eat. For people who are educated, I tell them, you just go into the internet, just see, search this fruit, how much glycemic index does it have? Does it come in high glycemic index ka group, or does it come in the low glycemic? You try to eat those low glycemic index ka fruit.
Okay.
Right, it is just a simple thing which I told you. That's an example. So that is how you can modify your diet. So there is different modifications for different comorbidities. But in a way, whatever you eat, if you eat in an optimal manner and try to avoid the fast food, the fast food, especially whatever you eat outside, like be it gobi manchuri or whatever the shawarma rolls or whatever you're eating, you keep it in an optimal manner, right? That is one thing. The other part of lifestyle modification is your exercise. So exercise at least 30 minutes per day. That is what WHO guidelines suggest for even a patient who is diabetic or hypertensive or dyslipidemic. At least 30 minutes of brisk walk. Even if you do 5 times in a week, 5 days in a week, that is sufficient enough, I feel. So majorly it is diet and the exercise part which you have to take care of to modify your lifestyle.
Okay. So, and also, you mentioned about lactose intolerant, and I have also heard like people saying, okay, what is good for your body, what is not good for your body. So, do we have any specific test for them that okay, what should I eat according to my specific body? What suits me? What should not I should not eat?
There are no specific tests as such,
Okay.
but this is something which you discover after like eating, having an experience out of it. So there is no particular test like that.
Okay. There's nothing like
Not-
okay.
but definitely there are like for like specified or identifiable diseases like lactose intolerance, there are enzyme levels which they check.
Okay.
That is to confirm, right? But we can't in pre-hand we can't tell that this patient is lactose intolerance. Once a patient has some lactose containing food,
Okay.
he'll understand that he's having GE upset. GA matlab gastrointestinal upset.
Okay.
Then he'll come to a doctor, then you can confirm with some
Okay.
test.
So there's nice.
There's nothing which is
No.
pre-hand test. There is nothing like that.
Like as I know that okay, in Indians we don't have these allergies and all, but in USA they have the history of allergy. Okay, this person should eat this. This should. There is nothing like that. Okay, what a person should know that okay, this is good for him or not good for his specific body. No test as such.
So about the allergy part,
Hmm.
there are tests called skin prick tests.
Okay.
So what they do is basically they test some multiple like common things, like 20 different things which
Hmm.
a person can have common allergies to.
Okay.
So that they'll prick it on the skin
Hmm.
and see for a reaction
Okay.
at what is called as the delayed hypersensitivity reaction.
Hmm.
So by that method, that's a very crude method, but still it's a, in a way you can identify what could the person be allergic to.
Okay.
That is there.
Hmm.
Yes.
Okay. So, and also, like you said about, me being in this world, okay, what I'm seeing is people, it's not like, okay, they really want to eat shawarma every day and all,
Ah,
but the notification pushes them and they feel like, okay, eating it.
yes,
And
yes,
also,
yes.
sometimes if it is not notifications, also, our body start asking. So, it is called as craving. Okay. So, to come out of this craving, what a person should do? Like, is there any solution for it? Because
Yes, yes,
people
yes.
crave for it.
If I have to talk about the biochemical aspect to whatever the question you asked,
Mhm.
so there are some neurotransmitters which are acting at the your satiety center,
Okay.
the level of the brain.
Mhm.
Okay, so there are certain neurotransmitter which increase your satiety. There are certain neurotransmitter which decreases your satiety,
Okay.
which makes you feel full
Okay.
after certain limit of whatever you had,
Mhm.
right? So the obesity part starts with a mismatch or imbalance between these neurotransmitters,
Okay.
wherein your satiety hormones, they're on a lower side
Mhm.
and your hunger hormones are on the higher side.
Okay.
This creates something called leptin resistance.
Mhm.
Okay, so that resistance part comes and it is aggravated by systemic inflammation.
Okay.
See, the craving part, it is difficult to take control of it.
Mm.
I agree, but the inflammation part, definitely you can have a control of it by
Okay.
changing your lifestyle.
Mm.
That is what I would suggest, because cravings though everybody has,
Mhm.
we can't try to avoid like completely whatever you want to eat,
Okay.
right? That craving parts though,
Mm.
that imbalance, we can't do anything about it,
Okay.
but slowly
Mm.
over the course of time,
Mm.
once you try to achieve that low inflammatory state
Mm.
by changing your diet, changing by exercising regularly,
Mm.
that somehow will help you to get into a state where you can't even come back, or you go into some chronic disease.
Recently watching some news in that they were saying like in US and all there is a drug now today which will help you to like work on your cravings, and if you take that drug, okay,
Right,
it
right.
will help you to
These drugs are something called, you might have heard, semaglutide,
yes.
tirzepatide,
Mhm.
right? So these are the drugs which are working on those hormone levels,
Okay.
right? So there is something called GLP which is secreted
Mm.
through our gut. Whenever
Okay.
you eat something,
Mm.
there is a hormone which is secreted called GLP,
Okay.
glucagon like peptide 1.
Mhm.
So this hormone basically acts like a satiety hormone at the peripheral level.
Okay.
I told you there are neurotransmitters. There are
Mm.
some neurotransmitters which are occurring which are working at the central level, at the
Mm.
brain level,
Mm.
and certain hormones which are working at the peripheral level, like in
Mm.
your gut.
Mm.
So when these are released, you feel full.
Mm.
So these drugs, they are mimicking like GLP ones
Okay.
and making you feel full.
Mhm.
Thereby, you are cutting down your food intake,
Mhm.
and if you're cutting down your food intake, your energy,
Mm.
whatever you are putting into the body is reduced.
Correct.
Then that mismatch, whatever was there,
Mhm.
energy consumption and the
Mm.
expenditure, that mismatch is reduced.
Reduced. Okay. So, see, whenever I have heard of any drug in the market, it might be like drugs means people think some other drugs. So I'm talking about the chemist drugs.
Yes,
Okay.
yes, yes, yes.
So any drug which is like going against the rule of the world, even it being scientifically proven, also
Right.
there might be some of the other side effects which it
True,
creates.
true, true, true.
Okay. So how does this drug? Okay, because as I heard in
Yes,
India also,
yes,
people who are having obesity already in US they're fighting obesity by this drug,
yes,
and in India also it might be there are already rich people who are utilizing this
yes,
and
yes,
trying
yes.
to reduce their this thing. So if it is going to become like again so many people start using it, so what do you think about it? It is right for
Yes,
the body or?
definitely. Whatever drug, whichever drug is being developed,
Hmm.
Definitely they are regulated. They are going through different clinical trials,
Okay.
and then finally approved by the FDA.
Mhm.
The side effect part, sometimes you get to know only after long term use.
Okay.
And any drug
Mm.
definitely might have some side effect to it,
Mm.
right? So my professor used to say,
Mm.
before prescribing some new drug which has come into the market,
Mm.
first look at the side effects.
Mm.
Go through the clinical trials, see what side effects were there,
Correct.
what percentage of people had that definite side effect,
Mm.
right? So you need to be aware of these side effects. Now whatever the drugs which we talked about, the semaglutide and the tirzepatide, somewhere over a course of time,
Mm.
okay, we might come across certain side effect which
Mm.
we don't know presently.
Okay.
Now we already know few of the side effects which are like uh, rare.
Okay.
Rare in the sense, once in 1,000 people some
Mm.
patient have had this acute pancreatitis after having this continuous usage of semaglutide.
Okay.
So we came across after knowing, okay, after
Okay.
using that for
Using
certain time.
certain.
So like this, we might come across such side effects after like over a period
Over
of
a
time.
period of time. Okay. So right till now, though it is not that effective. People can go for it.
So I'll tell you where it might be effective.
Mhm.
So you try to do your lifestyle modification by doing the proper diet, by following the proper diet, doing some physical activity, going through the exercise part, everything, and then you are in some energy deficit.
Mm.
Then your whatever the excess of energy of acquired
Mm.
starts to burn, gets utilized. Then slowly your weight loss journey starts.
Okay.
For that to kick in, it will take time.
Mm.
Definitely you have gone through a tedious process of diet and exercise.
Mm.
Now your body is designed in such a way that it will adapt to whatever adversities it is put through.
Mm.
Now you are putting that body in an energy deficit state.
Mm.
So what it will try to do, it will try to accumulate whatever is there by doing some compensatory mechanisms,
Mm.
by releasing some other hormones,
Mm.
right? This part is where your drugs actually work,
Okay.
not when you start the weight loss journey,
Mm.
but when you are in the midway,
Mm.
where body tries to compensate and works against what you are doing.
Mm.
So these are the time where you have to actually use them, and more effective it will be when you use this at this
Okay.
point.
Got it. If I have to conclude in a way that okay, if anybody is trying to reduce his weight or maintain his lifestyle, so or maintain healthy body, okay, so basically he should calculate how many calories or intakes he's taking and
Yes.
how much he's gonna spend.
Yes.
If he's gonna create balance in that, okay, like most of this is gonna work. So there is nothing, no food that okay, which is more energy giving or there is no specific things like we cannot. But anything you take it, if you
Yes.
burn it properly,
Yes. Yes.
it would be like
That
good
is
thing.
about the calorie deficit what you are creating in your body,
Okay.
which is decided based on your ideal body weight
Mhm.
and for your type of work life.
Correct. Mhm.
If at all you are like a hard worker or moderate
Mhm.
worker, and then you have a sedentary lifestyle. So
Mhm.
based on what type of lifestyle you have
Mhm.
and what is your body weight,
Mhm.
if you are male or female, everything
Mhm.
matters. So
Mhm.
based on that, some calorie requirement for
Mhm.
your metabolism, the bodily metabolism
Mhm.
is required.
Okay.
Now what you are doing is, in calorie deficit,
Mhm.
you're trying to cut down calories so much so that you'll have some deficit like 200 to 300. Suppose a
Mhm.
patient requirement is 2200 calories per day for
Mhm.
some male patient who is a sedentary lifestyle worker.
Mhm.
What you ask him to do is, you keep calorie count
Mhm.
and bring it down to a certain level, at the level of 1800 or 900, where
Mhm.
he'll have 300 to 400 kilocalories deficit.
Okay.
Now over a period of time,
Mhm.
what will happen, that calorie deficit accumulates.
Mhm.
Slowly that calorie deficit is burning your fat.
Okay.
Okay, if I have to give you an example,
Mhm.
if I keep a deficit of 1000 kilocalories,
Mhm.
and I by doing some exercise or by diet modification,
Mhm.
okay, over a period of 1 week I'll be losing somewhere around 7000 kilocalories.
Okay.
Now 1 kg of fat contains 7.7 matlab 7700 kilocalories.
Okay.
Now if you have controlled that, matlab, you have completed that goal of
Mhm.
doing the deficit for
Okay.
7000 kilocalories, you're almost losing 1 kg of fat.
Okay.
So what matters is the calorie intake.
Okay.
that definitely you will have to keep a count on your calories and try to maintain a deficit.
Okay.
Now if you are building some muscle,
Hmm.
then definitely you should consume a certain amount of proteins which are higher than other parts, your carbohydrates and your fats.
Okay.
And each of this, the macronutrients, the proteins or your fat or carbohydrates, they have specified kilocalories per grams.
Okay. Like today, whenever people are getting some issues in their body, okay, instead of calling a doctor, they go to ChatGPT and ask. Okay, so it's
I
practical,
come
right? So
across many patients like that.
they directly go to Google. It was
Right,
Google
right,
before. Then
right,
from
right,
past 3 4 years, I'm hearing, okay, people go to
right,
ChatGPT and ask, okay, what should I do,
right.
okay, about these issues, okay. And as I coming from background of AI, okay, I know ChatGPT is a SRS model. It never says no to you. If you go and tell him, okay, sugar, I love sugar, I want to have sugar, he will say, okay, you like it, okay, please have it. Okay, that is how ChatGPT is built. Okay, it is
Right.
to satisfy humans. Okay, so what do you have to say about those people who go to ChatGPT and ask, okay, and how much they should really worry about it, and also is it a helping tool to the doctors, or it is like how do you feel about it? Like,
No, I come across a lot of people
hmm,
who come to me and they say, "Sir, I searched my symptoms. These are the symptoms I had. I put it on ChatGPT.
hmm,
These are the things it told me."
hmm,
See, what ChatGPT is doing is it is combining all your symptoms,
hmm,
it is putting it into a syndrome and defining differentials for it.
hmm, hmm,
So it can be anything, it
hmm,
can be n number of things.
hmm,
But what actual disease that patient has, or whatever the ailment he has,
hmm,
it might not have picked it up.
hmm,
So that comes from doctor's experience. Totally,
hmm.
the ChatGPT cannot replace a doctor. It
Correct.
can just replace a doctor who has learned ChatGPT.
Hmm. True.
It cannot replace a ChatGPT, right?
ChatGPT. Hmm.
So in this case, what we do is we try to tell them, yes, you have done this work, good. So what I would suggest is you follow whatever I tell you,
Okay.
right?
Right. Correct.
That is important.
Hmm. Hmm, hmm. So, ठीक है. And also, like, I think you have also used ChatGPT on, right? Okay, when it comes to medical data, how much do you think, okay, it is accurate? How much, according to you, if not
Uh,
facing the data numbers?
about that part.
Hmm.
So I told you I cleared my NEET SS exam this year. I could only get a time which is like short period of time of 45 to 50 days to
Hmm.
prepare for the exam.
Hmm.
So I definitely used ChatGPT. I could
Hmm.
not crunch all the information and read everything within like 45 to 50 days.
Okay.
For me to read whatever I read so
Hmm.
much in those 45 days or 50 days
Hmm.
without ChatGPT,
Hmm.
I would definitely take somewhere around 8 to 9 months.
Okay.
So, what I feel is, so
Hmm.
when you want to learn a new thing,
Hmm.
be it any field,
Hmm.
especially medical field,
Hmm.
which is so vast and advancing every day.
Hmm.
Okay, so for learning new thing, you
Hmm.
go with the textbooks.
Okay.
You learn through the textbooks.
Hmm.
You go beyond the textbooks and learn from the patients.
Correct.
Right. This is what matters in our field, especially.
Hmm.
Then, to understand that micro concepts and clear your doubts,
Hmm.
the micro things,
Hmm.
where you have to, if you want to learn something, you need to compare it with a similar disease
Correct.
and learn it.
Hmm.
To improve your memory,
Correct.
to understand it better,
Hmm.
you should definitely differentiate something with some other thing and
Hmm.
read it.
Correct.
That part is definitely, that is made simplified by
Hmm.
ChatGPT, I feel.
Okay.
Yes.
The question was like, okay, if a patient wants to go and ask ChatGPT, and if he puts the data
Hmm.
and he gets a solution, okay, how much accuracy do you think ChatGPT has to answer him as a doctor? I'm asking.
Okay.
So, should really patients at what criticality they should use ChatGPT and believe it, and at what time they should stop it?
Okay. I'll tell you out of my experience.
Hmm.
So, suppose I put in some patient's clinical scenario,
Hmm.
or regarding something I wanted to learn about a topic,
Hmm.
and then it gave me some information. This has
Hmm.
happened couple of times to me also.
Okay.
It would have given some information.
Hmm.
Then, out of my what do you call that, previous knowledge, whatever I
Hmm.
have acquired over the course of time,
Hmm.
I ask him, okay, do you think this is really correct?
Hmm.
Because I feel this is like that.
Hmm.
Because I have read somewhere,
Hmm.
okay, this is like this.
Hmm.
So it gives me an answer, a very diplomatic answer, I must say.
Hmm.
It says, you are right in asking.
Hmm.
I made a mistake.
Hmm.
Somewhere it is going wrong,
Okay.
right?
Hmm.
So it can't completely give you an accurate answer
Hmm.
all the time.
Correct.
It might give you
Hmm.
some of the time,
Correct.
not all the times.
Correct.
That is what I feel.
Hmm. So as a doctor, so you had some, you know something, so you answered. But a person who is believing that okay, ChatGPT is a great guy and going and asking him, he might
That's why you
simply
have to come to
believe
a
it.
doctor.
So even if you have ChatGPT free access also, okay, when it comes to health, don't take risk. Okay, go to a doctor and
Right,
make
right.
sure okay, like you are getting the right advice. Okay, so don't ask him only. Coming to this topics, okay, where we want to talk about uh, at what age, okay, what people should do. Okay, like this, can you give us a brief?
Regarding the medical career,
Medical.
right, right.
Yeah, let us go in that actually. So that is great. That question I wanted to ask you. Okay, see, today I have seen people. Okay, at the age of 6, students are starting to like a 6th standard. Okay, they are starting to study for NEET exam. Okay, so how really it is like to really being a doctor? Okay, we have to start at the age of 10 or 6 like that.
Definitely, it's a competitive world.
Okay.
The competition starts early.
Okay.
That is so true.
Hmm.
But somewhere I feel, if you have a structured approach,
Hmm.
and if you know what you want to do, what you
Hmm.
want,
Hmm.
what you actually want in life,
Hmm.
you're clear with that,
Hmm.
and you're being consistent to follow that beliefs and goals,
Hmm.
you can easily achieve it,
Okay.
right? You need not start it from the age of 6 or 10 or whatever you said.
Hmm.
So somewhere, uh, I think you have to be oriented throughout your childhood, and I think that majorly comes from your parents.
Hmm.
Because first learning happens at home,
Hmm.
and your parents are your first teachers.
Hmm.
So the attitude towards learning
Hmm.
should be put in a person, and the decisions and the judgment what a child should be taking
Hmm.
should be only given after certain age. Because my professor used to tell me,
Hmm.
"Ke, till certain age your parents act like your external frontal lobe," when he's teaching some neuroscience. So he
Hmm.
wanted to talk about the frontal lobe, which
Hmm.
is a part of the brain which helps in accumulating, taking judgment,
Hmm.
decisions,
Okay.
and
Hmm.
yes. So that part matures after a certain age.
Okay.
I mean mid 20s. So
Hmm.
till then, I think the children have to be monitored,
Hmm.
and their decisions have to be taken by the parents,
Hmm.
and they have to be motivated in such a way that the attitude towards learning happens,
Hmm.
right?
Okay.
It doesn't have to be you have to force your children to read from 5th standard or 6th standard for NEET SS or
Hmm.
NEET PG or NEET whatever,
Okay.
right? So that will happen at certain, whatever has to happen will happen at certain time.
Okay. So it also like okay, this is my personal question. Like okay, today the people are doing doctor. What is the reason of okay most of the people wanting to be doctors only? Okay. What do you think? Okay, like in India specifically, our parents
I
think okay,
wouldn't
doctor is the
totally agree
best.
everybody wants to be a doctor,
No,
but
generally
somehow
the parents
generally,
want their
yes,
kids to
yes,
become
yes,
doctor
yes, yes,
only. Huh.
yes, yes, yes. I think if you look at the pros to becoming a doctor,
Hmm.
yes, definitely you are someone who can trust if you're a good doctor.
Okay.
Then the respect you get in the society,
Okay.
being a doctor itself comes with some tag,
Hmm.
right?
Yeah.
The kind of respect you get,
Hmm.
that I have experienced
Hmm.
also. And yes, you get to be a someone who can help relieve some ailment.
Hmm.
That's like a
Okay.
that is like a divine thing.
Hmm.
So that is one thing.
Hmm.
But I feel because of, there is so much to learn.
Hmm.
There's so much like MBBS and MD, then DM,
Hmm.
and you get a delayed gratification.
Hmm.
Somewhere you feel burnt out,
Hmm.
either be because of the emotional stress
Hmm.
or be it some competitive exam.
Hmm.
So that is there definitely.
Hmm.
So going through that,
Hmm.
I don't know. It depends on an individual what he wants to do in life, what he expects out of life.
Hmm.
If he's ready to take up that a tedious journey. Okay, yes, I will do that MBBS and then I'll clear that NEET PG. I'll do my MD, which is obviously very
Hmm.
tedious thing,
Hmm.
and then again I'll clear a DMCA exam.
Hmm.
Then acquire so much knowledge, communicate with the patient, learn from the patient, textbooks,
Hmm.
learn the communication skills. This is not a simple thing.
Okay.
So definitely it has to be someone who is passionate about it.
Hmm. So,
So it can't
who really
be
wants
done.
to help people?
Yes, yes, yes.
Hmm.
The passion should be there, the compassion, the empathy thing,
Hmm.
all those things should be there, and it will definitely matter, because
Hmm.
without interest you can't do anything.
Correct. Coming to this medical medicine and doctors in India, okay, like how the medical health of an Indian person is taken care, okay, compared to the Western countries, okay, so where do we stand and how do you want to have, is there anything you have to tell about it?
So there are multiple school of thoughts.
Hmm.
Some people agree whatever we are learning in India,
Hmm.
the type of healthcare system we have,
Hmm.
for the kind of policies, healthcare policies we have,
Hmm.
we are doing a good job here in India, because if you see, the healthcare availability is very easy to the people in India.
Hmm.
Like if I want to take some drugs
Hmm.
for some simple ailments,
Hmm.
because we can't go to a doctor, many
Hmm.
patients do so.
Hmm.
Okay, they go to a pharmacy and get the drugs,
Hmm.
which we call over the counter drugs,
Okay.
right? This doesn't happen in UK or US or any other Western countries.
Okay.
So even for a simple minute ailment, even if you want to get your BP checked, you have to take an appointment, you have to go to an ED, you have to pay so much, or you have to have a good insurance.
Okay.
That part though, definitely
Hmm.
I feel we are blessed.
Hmm. India's
Our
blessed.
Indian patients are
Hmm.
really blessed because
Hmm.
of that part.
Okay.
The other part,
Hmm.
the guidelines, the protocols which we are following, they are adapted to our practicality.
Hmm.
What we can do at whatever available resources,
Hmm.
the infrastructure, whatever
Hmm.
is being provided, based on that we try to give best care to the patient.
Okay.
But there in UK or US, they
Hmm.
follow a certain protocol, the
Hmm.
latest guideline which has come up.
Hmm.
It has to be done this way,
Hmm.
there's no other go to it.
Okay.
Like I have heard from my fellow doctors, my friends who are working in UK, they
Hmm.
cleared their lab exam and they went to UK.
Hmm.
There, as a medicine trainee, they
Hmm.
call it as a trainee job.
Hmm.
So as a medicine trainee, they are not supposed to intubate also to a
Okay.
patient. Intubation basically means you are putting a tube. When patient is not able to breathe himself, we put a tube and connect to a ventilator.
Okay.
So that intubation part also comes, matlab is being done by someone who is specialized in it. That
Hmm.
person has to come and do it. But in our training,
Hmm.
what we see usually,
Hmm.
like if I myself have done almost like more than 60 to 70 intubation during my PG course.
Hmm.
The 3 years of my life,
Hmm.
I've done so many.
Hmm.
Like this, the procedural aspect.
Hmm.
And that procedural aspect also, the doctors here in India
Hmm.
are being
Okay.
trained like in a very flexible manner,
Hmm.
though there are risks to it,
Hmm.
but definitely you are learning,
Hmm.
because you are getting an opportunity. There is
Right.
no opportunity also there.
Hmm. Okay. In that way, like you feel India is procedure, and so that
Yes, 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 yes.
MBBS where Sanjay Dutt asked that question that भाई के form fill up करना जरूरी था. So in that way, तो when it comes to a patient, India is far better. कि at least they take care of first put patient and then go for the procedure.
Right,
So
right.
in that way, it is good to hear.
Hmm.
Okay.
Nahin, that is regarding the doctor learning aspect I talk.
Okay. हाँ हाँ.
But the patient aspect,
Hmm.
I think there are so many places where people are not even getting a basic whatever amenities, healthcare amenities they require.
Hmm.
I feel that has to be taken care of. That
Hmm.
comes from a system, not just the doctors. It
Correct.
should be a combined effort of social workers, your political leaders, whatever.
Hmm.
That I think that part definitely
Okay.
needs to be
Needs to be
worked on.
worked on. Okay. So, see, heard people like, okay, like they're saying in India, we need data says we need so many doctors Okay, that is what the world has to say. So much of times I have heard that, okay, they say we need these many doctors, these many doctors are not available and all they say. Okay, and also I see, okay, like the colleges are not growing in the number of seats are not there, many seats are not there also they say. Okay, so what do you have to say about this? Okay, do we really need, India needs a lot of doctors?
So I'll be very honest with it.
Hmm.
So what happens is, you are going through that process of doing MBBS and then you're doing MD.
Hmm.
So it's not an easy thing. You
Hmm.
have cleared two competitive
Hmm.
exams. You have gone through so much of stress.
Hmm.
You have seen so much of death and so much of, academic pressure, the competitive exam pressure,
Hmm.
the patient care pressure, learning pressure.
Hmm.
So much is there. Then in the end, even after doing broad specialty like in MD, you feel that you need to go and learn DM.
Hmm.
You want to advance your learning
Hmm.
further,
Hmm.
because there is, there is a surplus of doctors
Hmm.
where they are not even getting a simple senior residency post in some hospitals.
Hmm. Hmm.
They're searching for a job
Okay.
even after doing MD,
Hmm.
right? This is happening because there is no proper pay they're
Hmm.
receiving,
Okay.
and for the amount of knowledge they have acquired,
Hmm.
for the amount of skill they have acquired,
Hmm.
there is no proper infrastructure also being provided to them to
Okay.
give that particular care to a patient.
Hmm.
Like, even if I have to talk about the government hospital in Davangere,
Hmm.
which caters to so many patients from all across the district and so many outside the district as well,
Hmm.
being a tertiary care center,
Hmm.
the ventilator beds, the whole oxygen system,
Hmm.
it came up only during the COVID time.
Okay.
And being such a big hospital with they're already, every day they're seeing some 300 to 400 OPDs per day.
Hmm.
They just have some 10 ventilator beds.
Hmm.
So this is the scenario.
Hmm.
So though you have like doctors, need for doctors also is there
Hmm.
to provide what is doctor requires to provide that particular care is
Hmm.
not there,
Okay.
and the pay is not there, the
Hmm.
pay is not satisfying.
Hmm.
So somewhere there, I feel,
Even after bills are so high, okay, where the hospital is putting money then? Because like then if they're not able to provide facilities and they're not paying doctors only, so whenever these high bills come from these big hospitals, they give this so much of bills. So where they actually spent it?
I'll just give you an example of a patient admitted to an ICU.
Okay.
So the patient is coming to you, suppose patient came with heart attack,
Hmm.
which we call it as myocardial infarction.
Okay.
So patient is coming to you, his patient is having MI. So
Hmm.
first he'll undergo an ECG,
Okay.
then serial ECGs.
Hmm.
Then to confirm it, will send some test, be it troponins
Hmm.
or BNP, and then you'll have to do your basic blood workup
Okay.
to add the medication, which to be added, antiplatelet to be given or not, anticoagulant to be given or not. So you have to check for the coagulation profile, you check for the platelets, you have to do some
A lot of
certain
things. True.
basic
Hmm.
investigations. Then you have to get an X-ray done.
Hmm.
Then if patient needs airway, breathing, circulation support, then has to be put in the ICU.
Hmm.
Then definitely when a patient requires ventilatory support, he has
Hmm.
to be intubated, then ventilated. For that ventilation to be managed, then a person should be there who is trained in doing so,
True.
right? Then a critical care person should be there to manage any emergent things which are there.
Hmm.
You got it. Then a trained doctor who can diagnose the disease and put a proper treatment to it
Hmm.
should be there. Then trained nursing staff should be there who can cater to the ICU care.
Hmm.
ICU care doesn't mean that you're just putting the patient in the bed and then monitoring properly.
Hmm. Hmm.
That doesn't end there.
Hmm.
You have to take care of the nutrition, because
Hmm.
patient is critical. He
Correct.
can't take care of the nutrition himself.
Hmm.
Then then the infection part, you have to
Hmm.
make sure the patient is in aseptic condition.
Hmm.
Then definitely you have to take care of what you call thromboprophylaxis, so
Hmm.
that patient is lying down, he should not develop some clot, and that clot gets embolized to some brain or some
Hmm.
lung. Okay. Then like this, it's not just one thing.
Hmm.
There are so many people coming into picture, who are having a definitive role,
Hmm.
who are doing their job,
Hmm.
and patient requiring the investigations, procedures,
Hmm.
then your ventilation management, your treatment part, everything.
Hmm.
comes at a cost,
Correct.
right?
Yes.
So if you consider in a simple way, hospital बुला लेके, then patient was admitted, patient doctor told heart attack हुआ, treatment डाले भाई, तो treatment तो बल्ला का bill कर डाले, the bill was too high.
Hmm.
There is so much of expenditure
Expenses
also which
also.
is occurring there.
Correct. So people need to understand ke, like it's because as a patient, na, they what they're seeing is one doctor is coming and he's treating and he's going. Okay, they're not seeing the extra stuff what they're having. Okay, and the other things. Okay, and the medication cost also. So actually, who is making that they are not seeing? So the bills are like I think they feel it.
Yes,
It is
yes.
very heavy and all. And also in that case,
One
my question was okay, like paying so much of bill also. Okay, so most of the bill is going in according to this, it is going in the other expenditure and
yes,
the
yes, yes.
equipments and the this thing rather than people, companies, hospitals are paying to the doctors.
Yes,
Okay.
true. True, true, true.
That is what I was thinking. Okay. After DM, anything again is there? Like what people have?
So in medical career, DM is like the top degree which you can achieve.
Okay.
DM or MCH. DM
Hmm.
is in the medical field and MCH in the surgical field.
Okay.
So after this,
Hmm.
if you are interested,
Hmm.
if you are not burnt out,
Hmm.
so definitely there are fellowships
Okay.
which you can pursue.
Okay.
Like after DM interventional cardiology,
Hmm.
there is something called EPS studies. You do
Hmm.
fellowship in EPS studies,
Okay.
electrophysiological studies.
Hmm.
So it's never ending process,
Never
I
ending
can tell.
process. Okay. So, as a medical student, okay, who is doing MBBS or who is in PUC or who is like after MD, so in their career, I have also heard that okay, most of many people even drop out, okay, in MBBS. Okay, so what are the mistakes these medical guys are doing? Why they are getting dropped out also, and what all struggles they go through? Can you elaborate on this?
Right. So for to get into the MBBS, you need to clear an exam which is called NEET, and
Okay,
you need to get a good rank to get a good college.
correct.
So good college, it means where you get to have like good academic exposure
Hmm.
and exposure for research work,
Hmm.
and your hospital, how good the hospital is.
Hmm.
It caters to how many services,
Hmm.
how much patient it is giving service to.
Hmm.
Because ultimately what you're doing is you're learning from the patient.
Hmm.
Beyond books,
Hmm.
you're learning from the patients.
Hmm.
So to get into such a good college, you need to get a good rank,
Okay.
right? So once you get into a good college,
Hmm.
your learning doesn't end at the books level,
Okay.
right? So I come across a lot of medicos, budding medicos, who matlab, I belong to a teaching hospital, so I
Hmm.
come across a lot of students
Hmm.
who are just into reading textbooks,
Hmm.
just reading textbooks and nothing else.
Hmm.
They are being posted every day
Hmm.
for 3 hours every
Hmm.
day into the hospital as clinical postings.
Hmm.
They come attend, but there is no effective learning there. They
Hmm.
just come there, they just pass their time, they
Hmm.
just go back.
Hmm.
So this has to change. This is
Hmm.
happening at many colleges.
Hmm.
Okay, many especially private colleges and all.
Hmm.
So many people are not interested in teaching nowadays because the students are not interested in learning.
Correct.
If they are not showing interest, how will some teacher will show
Show
interest in
interest.
teaching,
Hmm.
right? That attitude has to change
Correct.
because they are going to be future doctors.
Hmm.
Okay, I feel they're having that great responsibility
Hmm.
which they're going to take in,
Hmm.
right? So that learning part should be effective, and they have to have that mindset yes, I'm going to be a doctor,
Hmm.
so I need to learn better.
Hmm.
I'm going to handle some patient's life.
Correct.
It's a life and death scenario.
Scenario. Hmm.
So that feeling, that compassionate feeling should be there.
Correct.
That is somewhere being lost these.
No, as I asked you previously that question that okay, why people want to become doctors and why parents are wanting us to become doctors. Okay, so that answer, okay, like the way the answer was also there, and also see people are coming for the name doctor. Okay, they are coming for the respect what they get in the world. Okay, so anybody who is coming for these things, okay, his output from doctorate degree is also those things. Okay, anybody who is coming to become a doctor, so that, okay, I want to learn and I want to cure the diseases. Okay, so he will get interested in doing those things also. So I, I seriously feel that today not only in doctor field, okay, it's about engineering also, it's about lawyer field also. People are being just dragged into, or just because, okay, there are some other outcomes, okay, they want to do those courses. Okay, it's not because, okay, they are really passionate to really solve the issues. Okay, see, if anybody, I don't have to tell anybody. There is a saying that, okay, if you want to do something, there is only one reason for doing it, because you want to do it.
Yes.
Okay, if you don't want to do, if you don't want to do it, there are thousands of reasons. I was not well, that, this bullshit, all the reasons are there. So today, if a student has to show interest, the answer is how much ever good teachers we bring, how much ever good equipments we bring, whatever it is. Okay, until he himself feel that, okay, I need to learn and I need to become a good doctor. Okay, tomorrow it is about life and death. Okay, I'm gonna handle a life and death. If I don't, if I been ignorant while operating a person, he might die. Okay, and he doesn't understand the this thing, he might not change. Because not only there, in engineering also, that's the reason I think the employability rate is also so big. Okay, the unemployment rate is so big, because so many engineers are there, but so many engineers are not getting jobs. So many doctors are there. Okay, might be. And also this mindset change. Okay, where people are like, okay, I want more specific doctor, more specific doctor. Might be that is also the reason why doctors has to go become more specific. Okay, because today more educated means, okay, I'll be like, okay, if I gastrology, I have a stomach issue, I need to go a person who is very good at stomach only. Okay, so that is also people what they are thinking. Okay, so I seriously feel like, okay, when students are doing like that, okay, we should give a psychometric test whether really becoming
I,
doctors
I
or
think
not.
I
Our
think
need should
I
include
think
a.
the problem is not with the thing what they want. It's
Mhm,
definitely they want to be doctors.
mhm,
That is not the actual issue here.
mhm,
The issue is the competitive exams.
mhm,
The competitive exams are becoming so tough these
mhm,
days because the seats are limited,
mhm,
and every year there are group of people, or I would call thousands of people who are not getting the seat this year, and again they are giving next year. So
mhm.
that it is getting accumulated.
Accumulated. Mhm.
That's very cumulative over the course of time,
Correct.
right? So the competition itself has grown to certain level.
Mhm.
Okay, they feel ke, I need to read, I need to read this textbook,
Correct.
acquire knowledge, acquire knowledge. So I feel a balance has to be struck somewhere
Mhm.
between learning from the patient and the textbook,
This book.
because everything you can't learn from the textbook.
Textbook.
Though
Mhm.
you learn and give your need, you get a good rank,
Mhm.
but what is the point if you can't handle a practical life, real
Correct.
life scenarios,
Scenario. Mhm.
right?
No,
That
that's
is
where
the
I was
major.
telling. Okay, if a person knows his personal trait, like we, when we are having a hiring process and all, we see skills, we see knowledge, and there is something called a self-image. Okay, what a person want to see himself as. Okay, whether he feels happy doing helping people. Not everybody in the world, okay, feel happy doing helping others. Okay, not everybody feel that, okay, not everybody can come and talk to everybody, because being a doctor means you have to talk with multiple patients, okay, from different backgrounds also. So introvert who doesn't speak only properly, who don't communicate only properly, might be it's not a good person to become a doctor,
Mhm.
right? So there are self images also what a test should have, is what I was suggesting.
Ah,
So okay, in that self, there are self images, okay, which will tell them, okay, what you are good at being also. So might be that will reduce the dropout scenario also, where they are not able to handle the stress, right? Because that is not what they're actually asking for, and they're getting forced to. Might be that's when they realize already 4 years ago. Okay, so if that
yeah.
also happens, okay, like in a NEET, is a psychometric test, whether his personal career is also like in Japan and all they say, na, they have the schooling system. Like, okay, from childhood they are seeing this boy is like what kind of human being, whether he's more kind. See, being a policeman, if I'm a kind guy, it is not good trait. Okay, because I cannot be like a चोर को नहीं मारूंगा, ठीक है, मैं मारता नहीं, दर्द नहीं देख सकता, ठीक है. Being a, you have to be kind as a doctor, I feel. Okay, might be sometimes, okay, the patient is not listening, you have to be harsh. So self image is also there. So in NEET and all, if they put bring up that kind of situation, means test also, where they understand whether these people are really good at being this kind of career is good for them or not. At least for second PUC people, they should do it.
That's a
And
good suggestion.
yeah,
Maybe people will come up with
come
it.
up something like they should
Something
check
like
it
that.
out कि भाई ये इसको सच में जाना है कि
जाना है
नहीं.
नहीं जाना है.
Not just because, okay, yeah, there is a, as you said, doctors, kids don't know, we take about the, we try to take the decisions for them, but sometimes, okay, we might also not be right for the decision taking decision. there are some scientific methods today which can help us to like help
That
them.
is that is one thing.
Mm.
But I feel after like MBBS,
Mm.
it is not just about the clinical care, matlab
Correct.
clinical approach and your patient care.
Mm.
Your door doesn't end there. You
Mm.
have multiple doors to enter. It is
Mm.
not just the MBBS part. If you have done your MBBS and
Mm.
you have become a doctor already,
Mm.
and you feel okay, it was not for me, I don't have that kind of compassion towards the patient, or maybe you feel okay, then I might have to take something else. There
Mm.
are so many other
Other options
opportunities
also.
as well.
Mm.
It could be a research thing,
Correct.
entering into multiple clinical trials,
Mm.
or it could be a teaching.
Correct.
Teaching,
Mm.
medical teaching, so definitely it's a blooming industry
Booming industry.
nowadays,
Mm.
because with the advent of so many
Mm.
competitive exams.
Correct.
So that is one thing.
Mm.
The other thing is telemedicine. The other
Mm.
thing is remote monitoring. You have so
Mm.
many wearable devices,
Correct.
right?
Mm.
So there are so many integrating with the technology, health tech clinics,
Mm.
right? So there's so many opportunities as well. If you
Okay.
feel okay, yeah, I might not be a person suitable for this, because
Mm.
that realization might happen
Mm.
someday to
Correct.
some person.
Correct.
That
So
might be
there he
there.
has other
Yes,
options to
yes.
choose
even
also. Where
even
yeah.
while
Mm.
choosing his broad specialty,
Mm.
you can choose some specialty where there won't be much patient interaction, like you
Mm.
have radiology. The
Mm.
radiology, it's basically means you are doing patient, as a physician I'll be sending you a patient,
Mm.
so regarding some investigation,
Mm.
some imaging investigation. So you will do particular investigation, you just write the report and ask me to correlate clinically.
Correct.
He's not interacting with the patient.
Mm.
He's just doing his job of
Mm.
looking, doing that imaging,
Mm.
looking at the image and then reporting it.
Okay.
So those things are also there.
There are there.
Uh,
Okay. So people can after MBBS
there's
also they
also
can again
they have
choose to
yes, they
uh,
have their opportunity to
options to
reiterate.
read.
Uh,
So what are the 5 tips you want to give it to a youngster, okay, who wants to keep himself healthy towards his life?
Yes, the first and the foremost thing, the
Mm.
lifestyle modification, be
Mm.
it diet or exercise,
Mm.
that has to be included, inculcated in the lifestyle.
Mm.
That is one thing.
Mm.
Then you have to maintain a balance with the mental health as well.
Mm.
So somewhere when you are busy and you are into some very tedious job or learning something very uncomfortable, something like that,
Mm.
you find a break,
Mm.
you rest, you give time for yourself.
Mm.
Okay, so take care of your mental health, which
Okay.
is also very important these days,
True.
because the mental and the behavioral diseases,
Mm.
uh, they are like blooming,
Mm.
right? Not just the medical field or any other.
Mm.
If you consider, actually don't have like five definite
Tips.
tips, but these are the few tips
Tips.
I
Okay.
would like to give.
Mm. See. Any specific advice for the students who are what they're doing wrong and what they should do right? Okay, for very specifically going for after MBBS, I'm asking.
After MBBS, yes, you have time to decide what you want to take up.
Mm.
There are so many different opportunities, like we discussed
Mm.
already. No, even before your MBBS ends,
Mm.
you make sure you
Mm.
understand what you're interested in.
Mm.
Because once you are done with the MBBS
Mm.
and you're into the competitive exams,
Mm.
which are like very, very tough
Mm.
these days, and you take so much effort, you put in so much effort to clear those exams, and many people, I've heard from so many people, I hear so often as well,
Mm.
okay, they don't know what they want to enter into.
Mm.
They are keeping whenever I talk to them, they're like, I'm keeping my options open, sir.
Mm.
I don't want to stick to some particular, that
Mm.
I don't think that's a good idea to do.
Mm.
Before your MBBS ends,
Mm.
know what you are actually interested in.
Mm.
Like for me, I was sure if I want to do DM, I will definitely do it in general medicine,
Correct.
and I will not choose any other thing.
Mm.
But I come across so many people
Mm.
who are like not so
Mm.
sure of what they want to do.
Mm.
That shouldn't happen.
Correct.
Even my DM,
Mm.
we have so many multiple super specialties,
Mm.
cardiology, neurology,
Mm.
endocrinology,
Mm.
your hepatology, gastroenterology, hematology,
Mm.
infectious disease, critical
Mm.
care, so many things.
Okay.
But I was sure if I want to do DM,
Mm.
I would do it in cardiology.
Okay.
And other thing.
Mm.
So other thing is, how would you decide? So you decide based on what you're interested in, definitely. And it shouldn't be care. Yes, now though I have done my MBBS, I am supposed to do MD. I'm supposed to do MD is not the question.
Mm.
Do you want to really do it?
Mm.
That is the question.
Okay.
The supposed part,
Mm.
okay, yes, for this particular world, I need to
Mm.
do MD definitely after my MBBS. That is not needed
Mm.
because there are so many other opportunities as well.
Right.
Likewise, after doing MD,
Mm.
do you want to take up BM or not? That should be again out of interest.
Mm.
If you have interest in learning that particular subject more in detail, then you go for it. Otherwise, eh, there are so many physicians already in Dangere. No, I want to do something else also.
Mm.
Let me do DM. Let
Mm.
me be cardiologist now.
Mm.
That shouldn't be the attitude.
Okay. So, well, as a patient, this thing I have this question. Okay, like when I choose which doctor should I go, how do I do that also?
So what happens is you definitely there are so many broad specialities,
Mm.
medicine, surgery,
Mm.
and your OBG,
Mm.
right? Dermatology. These are
Mm.
the broad specialities.
Mm.
So you go to a patient if you have some skin problem, you go to a dermatologist. There is
Mm.
no other way to it,
Mm.
right? Even otherwise, many people what they do if they don't understand what they are supposed to do, which doctor to go to, they come
Mm.
to a physician.
Mm.
Now, a physician, what he does, he looks into all the clinical features of the patient
Mm.
with his symptoms and the signs, and he might refer. I am not the doctor to treat this condition.
Mm.
I suspect this could be the case.
Mm.
This is what you have, so you
Mm.
better go to a dermatologist, or
Okay.
you better go to a
Mm.
gynecologist, or you better go to a surgeon who
Okay.
will take care of the
Mm.
diseases further.
Okay. Recently, what happened is like I had an employee. Okay, means I have an employee right now, so she's working for me. Her mother, she was admitted almost 6 months. Okay, and doctors didn't knew after 6 months also what is wrong with her. Okay, because she being a Brahmin. Okay, doesn't eat meat. Okay, doesn't know vegetarian she is. Okay, and she is not a drinker. She is not a smoker, but her body had so many issues like okay kidney gone also, liver is getting one way. Okay, or this what do you say that that is this is now we have to cut fingers. Okay, कुछ बोलते हैं ना pancreas कुछ क्या बोलते हैं gangrene.
Gangrene, yes,
Okay,
yes.
gangrene happened to her. Okay, so multiple things happened. Okay, and before that also I had a friend. Okay, whose issue was that syndrome. Okay, where the body starts eating your own organs. Okay, there is one lakh 10 lakh people, one person will get that syndrome. I don't know the name of it. Okay, where the body starts
Maybe,
eating your own
maybe you are talking about the autoimmune conditions, autoimmune diseases.
autoimmune.
Uh,
So yeah. So when I have seen multiple, there is one more patient. Okay, and when I see these people's history, right? Okay, so I personally means doctor took so much of time after 6 months. I don't know like why it happened. Okay, why so much of time was taken. Okay, no, but when I see they have one common thing like there was having this protein drinks like Herbalife. Okay, they were taking that. Okay, so from there and there are some things like that. So the people who are trying to take supplements and nutrients,
right.
okay, for them, and also like okay after science being so great also, okay, why the doctors are not able to diagnose it is so fast. Okay, so
Yes. What is happening is
hmm,
there are so many new diseases which are coming up, which
okay.
we might not have discovered previously.
Hmm.
We might have come across certain things in a patient.
Hmm.
We might have called it as idiopathic. We don't know the cause. Why did it happen?
Hmm.
Why this patient had all these features?
Hmm.
Now, those idiopathic things are getting converted into specific diseases.
Okay.
For example, recently, if I have to quote a disease, if I have to name a disease, it is called as Vexus syndrome.
Hmm.
Till matlab maybe like 4 5 years, till
Hmm.
back in 4 5, till then nobody knew if someone had those particular symptoms,
Hmm.
why this occurred, what
Hmm.
has happened to the patient.
Hmm.
So now we are understanding
Hmm.
after seeing coming across so many patients like this with
Patients.
certain different clinical features.
Okay.
Now we are understanding that this could be certain disease. Now we labeled it as Vexus syndrome.
Okay.
So there are so many things like that where
Okay.
we can't explain.
Hmm.
So definitely there are so many n number of diseases,
Hmm.
but somewhere we might come across, we might discover, we might label it as in the future as well.
Okay.
So that is one thing. And other thing is, sometimes what happens, suppose like you said, your one of your employees mother was admitted for more than 6 months. Yes, when patient is in a healthcare facility,
Mm.
he is prone for healthcare associated diseases as well,
Mhm.
most often the infection part.
Mm.
So if at all he stayed for like he or she stayed in a hospital for like more than for 3 4 months or 6 months, he is definitely or ought to get any hospital acquired infections.
Okay.
Those infections are most often deadly because they're originating from the healthcare.
Okay.
Definitely they will be antibiotic resistant,
Mm.
because you're already giving antibiotic for so many patients in the
Okay.
hospital. The
Mhm.
organism which is originating within the hospital, they
Mhm.
tend to be more often resistant to most of the antibiotics which we are using in day-to-day scenario.
Mm.
So that is where
Mhm.
the management becomes very difficult.
Mm.
You're giving antibiotics, you're giving
Mm.
higher end antibiotics,
Mm.
but that organism is resistant to it.
Mm.
You can't just come up with some new molecule to treat
Correct.
that organism,
Mm.
because it is resistant,
Correct.
right?
Mm.
So that is other part.
Mm. And any advice for the people who are taking supplements and all? So
Yes.
what actually they should do?
Yes. So there are so many people who come to me. I have seen so many cases as well. So they suppose a patient had a stroke.
Mm.
Stroke is basically like, if I have to say in a layman word, it is something like brain attack, where the blood supply to the brain is cut off
Mm.
because from some reason,
Mm.
right? One patient has had stroke.
Mm.
So patient usually try to take them to some Ayurvedic medication, matlab Ayurvedic doctor
Mm.
who doesn't know anything
Mm.
but knows how to talk to people.
Mm.
Hey, Panniyamma, hey, na Martinamma.
Mm.
So the people get fooled by such people.
Mm.
They are supposed to come as
Mm.
an emergency basis to a particular primary care physician,
Mm.
but they go to some other doctor
Doctor.
who doesn't know anything but know
Mm.
how to speak.
Mm.
So that is where people are getting misguided.
Mm.
This happens most often with the stroke patients.
Mm.
They know ke sir ಅಲ್ಲಿ ಯಾರೋ ಒಬ್ರು ಇದ್ರು, he told ಕ್ಯೂರ್ ಮಾಡ್ಬಿಡ್ತೀನಿ,
Mm.
ಫುಲ್ ಸ್ಟ್ರೋಕ್ ಸರಿ ಮಾಡ್ಬಿಡ್ತೀನಿ. No,
Mm.
it doesn't happen that way,
Mm.
right?
Correct.
Time is brain. So
Mm.
before you get the patient,
Mm.
after going to the Ayurveda, and it might be too late,
Correct. True.
right?
Mm.
So be aware of such misleading or such things
Mm.
which can be more harmful than beneficial.
Harmful.
And many things, many a times I have come across a patients where they took some Ayurvedic medications. It
Mm.
was supposed to be increasing their energy levels. They felt some generalized fatigue, and then they went to some Ayurvedic doctor, and that he suggested some medication.
Mm.
Most often these things contain heavy metals.
Mm.
Those heavy metals act like toxins to the body.
Okay.
Okay, unless you test them what particular heavy metal is there in particular treatment what is taking, you
Mm.
can't even cure it.
Mm.
Okay, most often they come with acute liver failure,
Mm.
right? So that happens. And most of the times the patients go for the problems of arthritis, joint pain,
Mhm.
they are prescribed steroids.
Mm. True.
See, when a doctor, a learned person is prescribing you steroids,
Mm.
he knows how much to give,
Mhm.
how much to taper.
Mm.
If you are giving steroids, what else to be taken care of,
Taken care of.
right? So someone who doesn't know all of this
Mm.
just gives steroids, and steroids are like robust drugs which
Mm.
they take care of the inflammation very rapidly.
Mm.
So they feel better very soon. The
Mhm.
arthritis part that comes down, and they feel ke hey, ಇವ್ರು ಯಾರೋ ತುಂಬಾ ಚೆನ್ನಾಗಿದ್ದಾರೆ ಡಾಕ್ಟರು, ಇನ್ಮೇಲಿಂದ I'll continue this.
Mm.
They don't know the long term effects of the side effects of steroids.
Steroids. Mhm.
They develop something called Cushing syndrome. They develop
Mhm.
something called osteoporosis. They're
Mm.
prone for infections. They're prone for steroid-induced psychosis.
Mm.
There's so many n number of side effects I can name with the steroids. One, they are used in unregulated manner.
Mm.
I'm not telling steroids are bad. Steroids are the bread and butter of all the rheumatologists.
Mhm.
But when you don't know and you prescribe to the patient,
Mhm.
just because patient felt better ke steroids on mele some medication they don't even know, then we have to ask them, did you take these medications? Were you given some medication to treat your arthritis problem or something else? Then they tell, ah, sir, I was given this.
Mm-hmm.
Right? So many times this happens. And even the NA sites,
Mm.
what we commonly use, many people come to me, sir, body pain ittu, sir, severe ittu, adi knee pain ittu, some pain was there. So I took this NSAIDs. NSAIDs are basically non-steroidal anti-inflammatory drugs,
Okay.
which you commonly get as analgesics. You
Mm.
might have heard of aceclofenac, diclofenac,
Mm.
right? So ketorolac, such things. So you don't know, when you use it in an unregulated manner, just because you're having pain, you got the medication easily available is there, then you took it, you felt better, you don't know what is the adverse effect of it.
Mm.
The long term, your kidneys are getting fried,
Mm.
basically. So that is happening. So these are certain things which people should be made aware of.
Okay.
Still, there somewhere, this is lacking in patient education.
Mm.
They come up only after they have had these complications related to whatever drugs they're taking.
Okay. And also these teenagers, okay, from the age of 16, we boys start feeling that okay, we should have muscles, okay, 16 boys have muscles, okay, and all such things, and they want to make it very fast, and they go for steroids. Okay, gym guys comes and tells, okay, take this supplement and all such things. So what do you actually have to advise for these teenagers who want to actually go and do this build body and all?
Yes, as per my knowledge,
Hmm.
there are different types of supplements what you
Hmm.
can take.
Hmm.
So one is your protein supplements, right?
Hmm.
So those protein supplements, they are useful when you want to build your muscles,
Hmm.
definitely.
Hmm.
But it should be optimized and regulated how
Hmm.
much you are taking,
Hmm.
and also what type of protein you are taking,
Hmm.
because many a times those protein intake, whatever their extra proteins they are taking, might be causing so many side effects to them
Hmm.
when they're taking in excess or in an unregulated manner,
Hmm.
or which is not appropriate for them,
Hmm.
which is not good for their gut.
Correct.
So they come with gut related illness, they
Hmm.
come with skin related acne issues. So
Hmm.
those things happen.
Hmm.
So that you have to take care of when you're trying to take extra protein supplements to build
Hmm.
your muscles. Okay,
Hmm.
so that is one thing. And yes, definitely there are certain formulas to decide how much grams of protein you need to take when you are doing so much of workout, and what is
Correct.
your body weight,
Hmm.
your lean body mass, and
Hmm.
what is your target.
Correct.
Based on all of this,
Hmm.
there are formulas to calculate how much to eat, how
Okay.
much protein to take.
Hmm.
Yes, so that is one thing. The other supplements, they what they talk about is the micronutrient part, the
Hmm.
vitamins, the mineral oils,
Hmm.
all those. These are naturally occurring,
Yeah. Hmm.
what you require
Hmm.
day to day basis. But few of the vitamins, when they are in excess,
Hmm.
what you call it vitaminotoxicity,
Hmm.
so they also can cause
Okay.
damage,
True.
right? So again, it should be regulated,
Regulated. Yeah.
right?
God has nothing created. Like, okay, if anything in excess is gonna be a problem. If anything you're gonna avoid,
Yes,
there
yes,
is
yes,
nothing
yes.
like that. You have to
You have
balance
to,
only.
yes,
Yeah.
you have to achieve that balance.
Balance only. Okay. Thank you so much, Dr. Azhar, for giving us so insightful answers on this. Okay, I hope this helped the people, doctors who are trying to do MBBS, or means after MBBS DM, and what should they do actually, and even the need guys. Okay, it will inspire them, and also the answers we are given regarding the drugs and supplements, when they have to take, how much they have to take, and all, it creates an awareness. Okay, please consult your doctors. Okay, don't go to ChatGPT. Okay, and just ask him. Okay, ChatGPT has learned from the data, it is just a SRS model. Okay, make sure you go to a right person. They might be like, okay, this is something very tough love comes up. Okay, where they tell you what has to be done. Okay, they don't simply agree. Okay, you want to take it. Tomorrow it will be a problem for you. Okay, so you have to know, okay, who is the right person to help you with. Okay, so thank you so much.
Thank
Okay,
you, sir. Thank you
again,
for the opportunity.
thank you so much.